People talk about healthcare as if it's just a policy debate, as if it's just numbers on a spreadsheet, or another thing that politicians argue about on TV. But when you really look deeper, healthcare isn't just about insurance plans or deductibles or political sides. Healthcare is really a conversation about human worth. Because the moment you or someone you love gets sick or injured, the moment life becomes fragile, everything shifts. Suddenly, all the beliefs that we hold about who deserves care and who deserves help and who deserves compassion come right to the surface. And they tell us a lot more about ourselves than they do about the system. Today, I want to talk about healthcare and what it reveals about us, not as voters or consumers, but as human beings. I don't talk about this very often, but I've worked inside the healthcare system for years, both in medical billing and registering patients in the emergency room. And being on the inside changes the way that you see things. Because you don't just see patients, you see fear. You see people who waited too long to get help because they didn't have insurance. You see families pacing the hallway, not just worried about their loved one, but worried about the bill that's coming next. I can't tell you how many times I've watched the ER fill up, not because people wanted to be there, but because they had no other option. They had no insurance, no primary care doctor. The ER becomes the safety net, not because it's the best place, but because it's the only place. And then there's the part most people never see, the back end, such as the billing, the denies, the endless appeals. I've watched insurance companies deny claims for the smallest, most ridiculous reasons: a wrong code, a missing modifier, a deadline that's impossible to meet when you're dealing with human beings and real emergencies. I've seen life saving critical care, things like emergency interventions, trauma care, and even helicopter transfers to specialized hospitals get automatically denied, as if a person fighting for their life was nothing more than a transaction that didn't pass the filter. And then we, the billing department, have to fight like hell just to get anything paid. Hours of documentation, appeals, resubmissions, phone calls, and for something that's all for something that shouldn't have never been denied in the first place. And let me tell you something that most people don't know about the Affordable Care Act plans, the ones people hope will protect them. So many of those plans have hidden language buried in the details, language that the average person would never understand. People buy coverage thinking, oh, I'm finally protected, only to find out their local hospital is out of network, their doctor is out of network, the specialist is out of network. They think they're insured, and then they realize that they can't actually get care where they live. And now, with premiums skyrocketing because subsidies are disappearing, many people are losing coverage altogether. When you see this close up, not on TV, not in some political debate, but in real life, you realize something very quickly. Our healthcare debate isn't about healthcare, it's about how we treat people when they are at their most vulnerable that they will ever be. So when you step back and look at all of this, the crowded ERs, the denials, the fear, the confusion, the skyrocketing premiums, you start to see a much deeper pattern. We live in a society that treats healthcare as a privilege rather than a human right. And that belief shapes everything. It shapes the way we talk about sick people. It shapes the way we talk about people who can't afford insurance. It shapes the way we talk about the elderly, the disabled, and anyone whose body needs more care than the average person. We've been conditioned to see illness as a personal failure, to see vulnerability as weakness, to see needing help as something shameful. And because of that, we judge each other harshly. Why don't they just get a better insurance? Why don't they work harder? Why are they going to the ER for something so minor? Why are my premiums higher? Because of them. But none of this comes from wisdom. It comes from fear. Fear of getting sick ourselves. Fear of becoming a burden. Fear of needing help. Fear of losing control. At the deepest level, the way we talk about healthcare is really the way we talk about worth. Who is worth saving? Who is worth helping? Whose pain matters? Whose life deserves dignity? These are not economic questions. They are spiritual questions, human questions. Healthcare reveals something that most people don't want to admit. We live in a culture where people's worth is tied to their productivity, their income, and their ability to stay healthy. And when someone no longer fits the mold, when they are sick, scared, or struggling, society doesn't know what to do with them. That's the real issue. Not insurance, not deductibles, not networks. It's our collective discomfort with vulnerability in ourselves and in one another. So when you peel back all the layers, the arguments, the policies, the talking points, you realize something important. People aren't actually arguing about healthcare. They're arguing about what it means to be worthy. Because healthcare focuses us to confront the parts of ourselves that we try to avoid, such as our fragility, our morality, our dependence on others, our need for care, our fear of losing control, our fear of being helpless. And instead of sitting with those uncomfortable truths, we project them outward. We turn them into judgments. We turn them into policies. We turn them into debates about who deserves help and who doesn't. It's easier to argue about premiums than it is to admit that one day we will all need someone to help us. It's easier to blame the system than to acknowledge how scared we are to be vulnerable. It's easier to shame others for needing care than to admit that we too could lose everything with one diagnosis or one accident. Underneath every harsh opinion about healthcare is a simple, very human fear. What if I become the one who needs help? What if I can't afford it? What if I'm the burden? We judge others because we're terrified of becoming them. And when society is built on productivity and self-sufficiency, illness becomes a kind of taboo. We don't know how to hold it. We don't know how to talk about it. And we don't know how to offer compassion without feeling powerless. That's why the system feels so cold. Because it's built on fear instead of humanity. But the truth is, we are not separate from this issue. We're not above it. Every single one of us will be touched by illness, our own or someone we love. And when that day comes, all the judgments, all the debates, and all the us versus them conversations, none of it will matter. What will matter is simple. Did we take care of each other? When you strip everything down, the bureaucracy, the denials, the politics, the fear, healthcare becomes something very simple. Healthcare is about caring for human beings. It's about dignity. It's about compassion. It's about recognizing that we all move through seasons of strength and seasons of vulnerability. And neither season makes us more or less worthy. The truth is, healthcare shouldn't be something that we earn. It shouldn't depend on your job, your income, your zip code, your age, or your ability to stay healthy. Because illness, it doesn't care about any of that. Accidents don't care. Genetics don't care. Life doesn't care. And deep down, we all know that. This is why After being inside the system, after watching denials, after seeing people terrified to seek help, after watching hospitals struggle under the weight of uncompensated care, I believe there's only one real answer: universal health care. Care that is not based on profit, but on people. Care that doesn't ask, how will you pay, but simply asks, how can we help? Some people get uncomfortable when they hear that. I get it. We've been conditioned to think that helping each other requires deserving it. We've been taught to believe that necessity must be tied to worth. But universal health care isn't about politics. It's about humanity. It's the recognition that we are all, at some point, the person in the hospital bed. We are all the person waiting for results. We are all the person who just needs someone to care. And when we shift our mindset from who deserves care to everyone deserves to be treated with dignity, everything changes. Because suddenly, the ER isn't overcrowded. Families aren't afraid to call an ambulance. Hospitals aren't forced to fight for payment. People aren't avoiding the doctor until it's too late. And the conversation finally becomes about healing, not surviving. Healthcare should be the one place in our world where judgment drops away, where humanity rises above politics, where we remember that every life has value, including our own. When I think about everything that I've seen, the crowded ERs, the denials, the fear in people's eyes, the whispers families speak to each other in waiting rooms, I'm reminded of something simple, but profound. We are all just human beings, trying to get through life. We're all doing the best that we can with the bodies that we have, the circumstances that we were handed, and the systems we live inside of. And whether we realize it or not, we are far more connected than we pretend to be. Every one of us will eventually stand in that vulnerable place where we need help, where we need compassion, where we need someone to care without checking our insurance card, our job title, or our bank account. And maybe that's the deeper invitation here. Maybe healthcare isn't a political issue to argue about, but a mirror showing us how much we still have to learn about empathy, belonging, and shared humanity. Because when someone is sick, the question isn't, do they deserve care? The question is, are we willing to show up for one another? Are we willing to build a world where compassion is the foundation and not just an afterthought? Are we brave enough to see ourselves in the person who's struggling? If we can shift our mindset, even just a little, from judgment to understanding, from fear to compassion, from separation to connection, then maybe we can start seeing healthcare for what it is. Not a debate, not a burden, not a privilege, but an expression of the simple truth that we all belong to each other, and that every life, every single one, is worthy of care. Thank you for sitting with me in this conversation today. I hope it leaves you with not just thinking, but feeling a little more connected, a little more compassionate, a little bit more aware of the humanity that we all share. To go even deeper into worth and belonging, join me in the next episode where we will talk about immigration and identity.